Despite gains in tobacco reduction and control, tobacco use remains the leading cause of preventable death in Canada. Every year, more than 37,000 Canadians die from tobacco-related illnesses. This translates to a death about every 11 minutes. Thousands more are diagnosed with illness due to use of the product, and 16% of Albertans over the age of 15 continue to use tobacco products. When Albertans use our health systems, like acute care, primary care clinics, and dental offices, it is the perfect opportunity to provide tobacco intervention. In fact, patients report they expect healthcare providers to ask about and discuss their tobacco use. A brief tobacco intervention is potentially one of the most effective interventions that you can provide for your patients. It is proven to increase a patient's chances of quitting. Best practice guidelines recommend that tobacco be treated as a vital sign and recorded at every visit, and that brief tobacco intervention be a standard of care for all patients. This easy-to-do intervention can also be used by social service providers. The Ask, Advise, Refer, or AAR model provides a simple-to-use, least intensive, abbreviated version of a tobacco intervention. This model is best suited for care providers who spent minimal time with the client, workers who collect intake data which is used by another care provider for service or treatment, care providers whose scope of work does not allow for a more intensive intervention. Where time and scope of practice facilitate, full implementation of the 5A brief tobacco intervention is recommended to increase quit success. Let's discuss the three components of this model. The first A stands for Ask. The individual is asked about their use of tobacco or tobacco-like products. As you will see, the Ask can also be on a health questionnaire the patient fills out.
So it looks like here that you've checked off that you smoke cigarettes.
I've smoked since I was 16 years old. I've tried to quit. I've managed to cut back to a half a pack a day, but it's hard, and it doesn't help that Peter smokes too.
The second A stands for Advise. The individual is given a personalized message that stopping tobacco or tobacco-like product use is the most important thing they can do to improve their health, a chronic condition, or a treatment outcome.
As you probably know already, the hospital grounds are smoke-free, not just in the hospital, but the grounds around the hospital. And with your health issues and whatnot, quitting is the most important thing you can do for your health right now.
The R stands for Refer. The individual is directly referred to cessation supports provided in the care setting or available to them outside of the care setting. While providing someone with information or a brochure on services or supports is easy, this is not an effective referral. A direct referral is the best referral. Direct referrals can be made to an on-site tobacco clinic or counselor, respiratory services department, a community pharmacist, or primary care clinic. Or you can send a referral to Alberta Quits Cessation Services, like the helpline. Remember, the more direct the referral, the more likely the person who uses tobacco will follow through.
When and if you're ready to quit smoking, we would like to connect you with Alberta Quits. It's a group of services that's interconnected, and it supplies you with a lot of good information. We can do that through the diabetic clinic at any time. You don't have to make an appointment, just phone us and we can give you the information.
Let's watch a full AAR intervention in a dental clinic setting.
Now, Bob, when you were here for your teeth cleaning last time, we talked about your spit tobacco use?
Yes.
Yeah, now were you able to quit that?
No, I'm still using that some.
Okay. Yeah, like we discussed last time, it's the biggest thing you can do for your oral health is to get rid of the spit tobacco. Have you heard of Alberta Quits?
No, what's that?
Well, it's a free telephone helpline, and they have counselors there that can help you get rid of the spit tobacco. Is it okay if I send in a referral form for you and they can contact you?
Okay, it's worth a try, I guess.
Yeah, and basically they'll help you with your plan and they'll talk to you on the phone.
Okay.
Great, I'll get that done for you.
Now, let's watch an AAR intervention in a cancer clinic setting with a patient who is not interested in stopping.
So I just wanted to take some time to go over the responses that you put on your Putting Patient First form, just to see where you're at today. I see that you've indicated that you're smoking currently.
Yeah, I've cut back, but I'm still smoking about half a pack a day.
I feel I just have to let you know that I know this is very overwhelming and quitting is very hard, but what you may not know is that quitting or even reducing your tobacco use is probably one of the best things you can do to increase the success of your treatment. We have a free and specialized clinic that can help you with counseling or medication to help you get started. Do you think I can make a referral for you?
You know, I don't think I want to do it right now. I have so much on my plate. It's just been emotional.
Yeah, I can appreciate that. Well, if and when you're ready, you can self-refer to the clinic at any time. There's some information in that pamphlet for you about, the benefits of quitting and contact numbers. So whenever you're ready.
As you can see, the AAR can be completed in less than 2 minutes and can flag tobacco use and interest in cessation support for a subsequent healthcare provider to provide more intensive intervention, including pharmacotherapy. Documenting an AAR is important because, as discussed, it flags tobacco use for subsequent care providers to follow up. Brief tobacco intervention provides an important performance measure in healthcare settings. AAR can be documented through electronic record systems. Some electronic client data systems have brief tobacco interventions built in. AHS will also be implementing the AHS Provincial Clinical Information System in the coming years to create common clinical standards and processes to manage and share patient information. Client-patient file stickers. If you use paper files, a sticker or stamp documenting AAR can be attached to the file or to forms that travel with the individual to their next care provider. There are many resources available to help you support your patients, including a cessation toolkit for healthcare providers, a quit kit, and other resources for patients. These are all available on the albertaquits.ca website under Helping Others. An abbreviated brief tobacco intervention is a quick, easy, effective way to make a significant difference in the health of an individual who uses tobacco. Remember, asking about tobacco use, advising to reduce or stop, and referring individuals for tobacco dependence treatment, including pharmacotherapy, will increase a patient's likelihood of making a quit attempt. If you want to learn more about providing tobacco interventions, check out albertaquits.ca for health professional resources and other learning opportunities.